Hi, my name's Georgia from BN Australia, and today I'm going to talk to you about how you can use your pelvic floor wand to treat the entrance of the vagina, the superficial pelvic floor muscles, or any tight perineal scarring or scar tissue that might be preventing you from having comfortable intercourse. So we are going to go through that with Veronica, my vagina or my vulva, but I'm first going to show you the anatomy here. So this is obviously the entrance of the vagina. You've got the clitoris bulb up the top, which will then extend down the length of the labia, and then you've got your urethra where your wee comes out. We've then got this section of the vagina, which is called the introitus, or the vulva, which is all the outside anatomy. You would then have your labia overlying this. So we're going to separate the labia, and we're working on the tissue either at the base of the vagina, or if you've got tightness or scar tissue up the top because you've had a labial tear or you're having pain up through the urethra, then you could use the wand there as well. But most of this video is going to be based around the base of the vagina or the posterior fourchette. So that's what it's going to look like in a more anatomical sense. And then to demonstrate, I'm going to use my fabulous pillow. So these are the labia, which we're obviously going to separate, and then this is the introitus, posterior fourchette, like I just said. So we're going to insert either end of the wand for this. I like using the more pointed end rather than the flat base end when I'm doing superficial release. And we're going to lube up the end, so make sure it's at least 3 centimeters in. And then we're just going to initially put it at the entrance of the vagina. So you'd be lying on your back, you're nice and relaxed, you've had a shower, you're not going to be disturbed, you've lubed it up, and then you're putting it at the entrance of the vagina. Sometimes you might want to start with just a really shallow penetration, so just a really small amount, just to make sure you feel comfortable. To get the true superficial layer of the pelvic floor, we want to be kind of in at least 3 centimeters into the vaginal canal, but you could be a little bit less if you need to. If we're working through tight scar tissue, which is at the base of the posterior fourchette, or maybe you've had an episiotomy off to one side, then we're going to start by just applying some pressure downward towards the bum. So you could be holding the wand at the neck, or you could be holding it at the base to apply that pressure down. I find the higher you have your hand on the wand, the more precision you have with the movement that you're going to do in the vaginal entrance. So if we've got this wand in the entrance, what we're going to do is just place some pressure down, taking a few deep breaths, making sure your pain levels are around a 3 or 4 or less out of 10. And then we might be doing some movement. So often people can tolerate pressure, and sometimes friction or movement can be more uncomfortable. So people often say to me in the clinic that they can tolerate if their partner's inside them, but they don't move. And then as soon as they start moving, they're getting an increase in pain. So them mechanoreceptors or the vaginal mucosa might be a little bit sensitive to movement. So you might need to do some movement or some frictioning at the base of the vagina to really loosen up that scar tissue. Once you've done some sweeps forward and back in kind of a U shape at the base of the vagina, then you might specifically turn it to one side, particularly if you've had an episiotomy, and spend some more time moving it forward and backwards on that side, or again, sweeping it forward or back with a little bit more of a lateral bias, so more coming to one side rather than the other. If we're working through labial tightness or more higher tightness, you can still insert that wand the same way and then just sweep up a little bit higher, or spend some more time up at the top of the vaginal entrance, being careful not to go near the urethra. It's not very comfortable for the urethra to be massaged, so we're never up like that. We're only out laterally, or we're coming down. If we're finding that that's tolerable and that's comfortable, then we might go in a little bit deeper, and then we might do some more pressure down and back with a little bit more depth, which will just be tensioning a little bit more of the pelvic floor and still the skin at the entrance of the vagina. Again, you might then do some sweeps forward and backwards, a little bit deeper in, making sure that you're nice and relaxed, belly's relaxed, you're taking deep breaths, all of those good things. We've got some breathwork techniques on this website if you want to look more into those. Once you've had some time inside the vagina, 2 to 5 minutes is what most people will be suitable for. You might have been told to do longer though by your healthcare professional, so always go by what your individual advice has been. You'll take the wand out of the vagina the same way that you went in, give it a wash with warm water, and then store it in the bag that was provided or in a dry place. And then before you use it again, make sure that you've washed it prior to use. If you have any questions, please let us know, and for more information you can obviously head to bn.com.au.